Welcome, my name is Kara. I'm a birthing center tour leader here at UnityPoint Health Meritor. We're so happy you've chosen to have your baby here. We believe we have the finest staff and facility in the area to care for you during this exciting time. There will be a lot of activity around you the day you deliver, and being familiar with your surroundings before the big day can be a huge comfort. Take some time to watch our videos. And one more thing, before we begin the tour, I'd recommend that you pre-register on our website for your stay. That streamlines the steps you'll need to take when you're admitted to the hospital. All right, we can't wait to show you around.
Hi, I'm Fatima, one of the birthing center nurses. I'll be leading you on a tour of our birthing center, beginning with our OB triage area. The triage team is the first team you'll meet during your labor experience. The team includes nurses, nursing assistants, physicians, nurse midwives, and resident physicians. If you think your labor has started or have any other concerns regarding your pregnancy, you should first call your OB provider. If they tell you to come to the hospital, then give us a call so we'll know to expect you. When you arrive, please feel free to use our free valet parking service when available. Once inside, head to the OB triage area located on the main floor of the hospital in the north wing. If you aren't familiar with the hospital, feel free to ask for directions and follow the signs to the north wing. In triage, you'll be greeted by a staff member who will show you to a private room for your evaluation. We'll take your vital signs, listen to your baby's heartbeat, and assess your contraction pattern. If indicated, a cervical exam will be done. Based on the evaluation, it might be time to admit you to your private birthing center suite. Your private birthing suite was specially designed for you and your family. We've tried to anticipate all of your needs, but if there is anything we haven't thought of, please let us know. The first question many people ask is about guests. Yes, guests can join you in your suite, and your support person is welcome to sleep overnight while you're here. We recommend adults as support persons. In each suite, you'll find a couch that opens into a sleeper bed. We provide linens so you don't have to bring them from home. If you'd prefer that your guests wait outside the room, the birthing center offers a guest lounge. The lounge has vending machines with beverages, a TV, and a computer with internet. Free Wi-Fi is also available throughout the hospital. What we do recommend you bring from home are those items that make your stay feel more at home. Things such as pillows, gowns, robes, footwear, and toiletries can be comforting. You may spend some time in your room before delivery, so we also suggest bringing books, magazines, electronics, and anything else you need to relax and pass time. Whether you're with friends and family or you're having some alone time in your suite, if possible, please take the opportunity to read through our childbirth and newborn educational book. This book can be found in your packet of information. If you've received this book in your prenatal class, we ask that you bring it with you. If not, we'll provide a copy when you arrive. Our birthing suites have some great built-in comforts that we hope you'll take advantage of, such as DVD players, rocking chairs, and our ever-popular soaking tubs. These are features our guests have enjoyed during their stays. We hope you will too. Upon admission to your birthing suite, the care team will greet you and get you settled. The care team includes nurses, OB providers, and residents. The nurse will take a set of vital signs, assess fetal heart tones, and document your medical history. She will also give you a quick tour of your room and unit amenities. During the admission process, your nurse will also assess your birthing preferences. We understand everyone has different preferences and expectations for their delivery experience. The admission is the perfect time to clarify with your team how you prefer to be addressed, explain any religious or cultural needs, and discuss your wishes concerning comfort measures, fetal monitoring, and any other preferences you may have. If you would like to complete a birth preference form, please visit our website. Bring a printed copy to the hospital with you to help facilitate discussion. Once you've shared your preferences with the team, an appropriate plan of care will be established. You'll see that all the equipment for your baby's birth is kept in the suite with you. Everything you'll need is brought into the room in time for your baby's arrival. During your stay, your nurse will regularly check in with you to assess your progress, offer support, and assess vital signs. You may have more than one nurse care for you depending on the length of your labor. Your cares and concerns will be passed from nurse to nurse during a bedside shift huddle that you will be a part of. Throughout your labor process, your nurse will be available to help assess your comfort level. Your nurses can help you find ways to relax and work through physical discomfort. She will show you different body positions, suggest showers, the soaking tub, warm and cold packs, birthing balls, and counter pressure as necessary. She is also there to help facilitate any medical intervention you may want or need. After you give birth, to promote bonding, we recommend holding your baby skin to skin for the first 1 to 2 hours. If you plan to breastfeed, an early start is best. We can help you get started within the first hour after birth. All birthing center nurses receive extensive training in breastfeeding support and are excellent resources for you. We also have lactation consultants available as needed. If you plan to formula feed your baby, you will be shown bottle feeding techniques during your recovery. Mother and baby care education starts immediately following delivery and continues until discharge. Your nurse will closely monitor you and your baby for a few hours after delivery to make sure there are no complications. If you feel discomfort, your nurse will assess your pain and work with you to determine the appropriate relief measures. Options may include medication, warm and cold packs, and topical anesthetics. Let us know your preferences and we will work with your wishes. Your comfort, care, and health are always our top priorities. Once your recovery is complete, you and your baby will be transferred to the Family Care Center located on the 5th and 6th floors of the birthing center. C-section stands for Cesarean Section birth, which can be planned or unexpectedly needed. Cesarean births are performed in the C-section operating suite located in the birthing center. Operating suites are staffed by birthing center nurses, so your nurse will remain by your side if a C-section is needed unexpectedly. To maintain a safe environment during a C-section, only one support person is allowed in the operating suite. Your support person will wear scrubs and need to perform hand hygiene before entering. You'll be able to hold your baby as soon as it is safely possible after delivery. It is okay to take pictures, however, videography is not permitted in the operating suites. After your C-section, you will go to the recovery room located outside of the operating suites. You and your baby will be closely monitored there for about 2 hours. Your nurse will assess your pain and work with you to determine the appropriate relief measures. Our baby-friendly principles remain top priorities during recovery. Skin to skin, feeding, and bonding are initiated as soon as possible. When you are considered medically stable, you will be transferred to the Family Care Center located on the 5th and 6th floor of the birthing center.
Hi, I'm Jen, a Family Care Center nurse. You will meet the Family Care Center nurses a few hours after your delivery, as long as you and your baby are both medically stable. Your delivery nurse will escort you both to a room on a different floor. For your privacy and comfort, we use elevators that are only for patients of the birthing center. Your private room will have a bed, a fold-out sleeper sofa for your support person, a glider, a bassinet for your baby, a TV, and space for your belongings. Each room has a private bathroom with shower as well. For many people, this is a new experience, so a nurse will be available to help you learn about taking care of your baby. One thing the nurse will do with you is your baby's first bath. This is done right at your bedside using swaddle bathing, a technique that keeps the baby warm and calm. If you would like to participate with giving your baby the bath, just let your nurse know. We do provide baby clothes and disposable diapers for use during your stay. This includes t-shirts, a knit cap, and blankets. You are also welcome to bring clothes and cloth diapers from home if you wish. In your room, you'll find a baby's bassinet. The bassinet is on wheels, so you can move it around the room. The drawers are stocked with supplies you may need for caring for your baby. With everything going on, you'll need to eat. For meals, you can order directly from the hospital kitchen. You will find a menu in your room. If you or your visitors have preferred foods not available from the hospital, you are welcome to bring in your own. There is a refrigerator and microwave available on the unit for your use. We know that labor, delivery, and breastfeeding can cause hunger at any time, so we also have healthy snacks available for you in the mother's nutrition room. Let us help you get what you need so you can relax. If family and friends would like to eat while visiting, our cafeteria and coffee shop are open during daytime and early evening hours. There are also several area restaurants that deliver to the hospital. We provide free water and coffee for visitors. You've had a big day. Now it's time to replenish, restore, and relax while bonding with your baby.
Hi, I'm Stephanie, a Family Care Center nurse at UnityPoint Health Meriter. We are proud to be certified as a baby-friendly hospital. Part of our commitment to being baby-friendly and providing the best care is to provide what we call rooming in. Rooming in means the infant will stay with you rather than in a nursery. Parents say they felt more prepared going home because they spent those first days bonding with baby in the room. Part of being baby-friendly is helping us keep your child safe. You can find safety tips in our childbirth and newborn educational book. I'll mention just a few safety tips for you now. Keep your baby with you or your support person at all times. If you leave your room, take your baby with you in the bassinet. Close your door when napping or in the bathroom. And always remember to put your baby in the bassinet while you are sleeping. This is the safest place for your baby while you nap. We use ID bands for you, your support person, and the baby. 2 bands go on the newborn immediately after birth, 1 will go on your wrist, and 1 will go on the wrist of your support person. Our nurses regularly check that adult and newborn ID bands match. For the protection of everyone here, all staff members must wear photo ID badges so you can easily identify the people who it is safe to give your baby to. It is okay to ask to see the photo ID. Again, I'd encourage you to check out the safety tips outlined in your childbirth and newborn educational book. Sometimes the most obvious things are the ones we can overlook. Just remember, we are available to answer all your questions before, during, and after your stay with us.
Hi, I'm Laura, the NICU Family Liaison at UnityPoint Health Meriter. NICU is short for Newborn Intensive Care Unit. Today, I'd like to take you on a tour to get you acquainted with the area in case you and your baby are admitted here. As you enter, one of our unit secretaries at the front desk will greet you and get you checked in. They'll help you fill out the daily infection control screener and share some safety tips, such as using hand sanitizer before entering the NICU. These procedures are to help prevent infections for our newborns, families, and visitors. Now let's look at one of our rooms. As you enter your baby's room, the first thing you'll see is the sink. We'll ask you to wash your hands each time you enter the room and every time you touch your baby. This may be more hand washing than you're used to, but it's for the safety of all the families and infants in the NICU, and we take this simple task seriously. Near the sink, you'll find cupboards and feeding supplies and linens. Also, you'll see a small refrigerator on the counter for storing your breast milk. In the NICU, you're welcome to stay with your infant 24 hours a day, 7 days a week. Siblings of all ages can visit the NICU, but we cannot allow any other children under the age of 12. For your comfort and for your guests, on the far side of the room you'll find a sofa that pulls out into a bed and cabinets for your personal items. Each room has a hospital-grade breast pump for use while your baby's in the NICU. For your privacy, you can pull the curtain shut to this area of the room. As you move closer to where the baby's bed would be, you'll find a rocking recliner so you can hold, feed, or spend skin-to-skin time with your baby. Every baby in the NICU is on a monitor like this one. It monitors their heart rate, respiratory rate, and oxygen saturations. These numbers can be seen in each room and at the nurse's station. Someone is always monitoring the health of your baby. You can monitor your baby too by viewing the NICView camera. These cameras are available to you to watch your baby when you're not able to be here. The baby's bed in the center of the room could be a crib, radiant warmer, or isolette like this one to keep your baby warm. Other equipment you might see in the NICU could be an IV pole, a ventilator, or oxygen, or suction. And last, you'll see the medical team's computer and desk area. We are here to help make your stay as easy as we can under what are often stressful circumstances, and we encourage you to participate in the care of your infant as much as possible. Some of the ways you can do this include taking part in feedings, ultrasounds, skin-to-skin care, and rounds. Rounds occur each morning when the medical team goes around room to room reviewing patients. The team can vary in numbers. Don't be alarmed. A larger team one day does not mean there is a safety or health issue in the NICU. They'll review your baby's information from the past day and plan for the next one. Feel free to be present, listen, share your thoughts and ideas, and ask questions. They are there for you. And last, as we exit the NICU, you will find the lounge. This is a space outside your baby's room where you can come to relax alone, visit with friends or family away from your baby. The lounge has a TV, computers, phone chargers, and a telephone, and a great view. This lounge is also where we hold our weekly support group called the SPIN group. SPIN stands for Supporting Parents in the NICU, and we even have a Facebook group. Each Friday at noon, we welcome all future NICU families, current families, and graduate families to join us for the SPIN group. Just let your nurse know you're interested. In the back of the lounge, we have a space for siblings to play and a library of children's books. And over here is the kitchenette where you can help yourself to coffee or snacks. There's room in the fridge and cabinets if you have your own food you'd like to store here. We'll provide labels to avoid confusion with other guests' food. Our NICU also offers a shower for families who stay over. We know that any time spent in the NICU can be unexpected, so every little comfort can help. Just remember, we're here to support you throughout your stay and after.
Welcome. My name is Kara. I'm a birthing center tour leader. Some of you may be wondering what happens when I go home. We'll try to make the transition easy. And of course, we'll be here for you even after you leave. Before you go home, if you bring the car seat to your room, your nurse can help you adjust it. Installing car seats can be complicated, so we also recommend making an appointment for a free car seat inspection by calling 608-890-8999. This is something you can do well before your labor begins. So it's just one more thing to cross off your to-do list. The length of time spent with us varies based on your needs. But to give you an idea, most people who had a vaginal birth stay with us 1 to 2 days, and if you had a C-section, the average stay is 3 to 4 days. On your discharge day, we ask that you plan to leave by noon. You'll want to have comfortable clothes for yourself and your baby, and you'll need blankets, diapers, and a car seat. We encourage you to visit our website and to register for a class or to learn more about our doctors who care for children. Whether you attend our childbirth or parenting classes, our mother-baby hour, or receive care from one of our pediatricians or family medicine physicians, you can consider yourself part of our family too. We look forward to welcoming you and your new baby to our family.